Dr. Michelle Oakley's in Alaska, and things are out of control.
Oh, don't do that.
It's birthing season,
It doesn't look like it's moving.
and new lives are in danger.
Whoa.
We just gotta hurry home.
Michelle's working overtime
Oh, you poor lovey.
to help these youngsters survive.
Oh, it's hanging out.
Michelle and her youngest daughter, Willow, are near Anchorage, Alaska, on an annual springtime trek.
In Alaska, springtime means two things: warmer days and lots of baby animals. Muskox, moose, reindeer, they're all having babies this time of year.
But for some newborns, Alaska's spring can be as harsh as winter.
Spring birthing season is a tough time for the animals. There's this hope of new life and regeneration, but there's loss as well. Are you ready to go to the Alaska Wildlife Conservation Center today? Yeah. It's gonna be awesome.
For Willow, this trip is a rite of passage, something her two older sisters have done before.
What would be your favorite animal? Baby anything.
The Alaska Wildlife Conservation Center rehabilitates orphaned and injured animals and breeds others for return to the wild. This time of year, they're brimming with babies.
Oh, you got some new baby muskox. They're tiny. Goodness.
But today, Michelle's work will help babies not yet even born.
Michelle, good to see you
Oh,
again.
hey, Mike. How's it
Hasn't been that
going?
long.
Mike Miller has asked her to disease test a herd of 500-pound elk scheduled for release so they can calve in the wild.
Yeah, we got a lot to do today. I'm anxious to get started.
All right.
Hurry.
While the crew heads off to work, Willow sets off on a baby animal safari. Soon, Mike will be shipping this herd of elk to native lands in the Aleutian Islands.
These elk are not handled that extensively. These are animals that are going to be released to the wild, so they're being kept as wild as possible.
Michelle will check them for adenovirus, a disease that can be fatal within 3 to 5 days, and it's contagious.
It's really important when you're considering releasing animals to the wild that you're releasing healthy animals. Once you get a disease out in the wild, it's really hard to get it back or to slow it down.
How many do you think we can do today?
Probably only 2, I would guess.
We're doing a couple because a couple tell you the whole herd health, but then eventually we'll have to test each one individually just to be absolute. And they'll probably be a little nervous, but
Yeah.
you can walk up there and then dart it with your rifle. What's it called?
Sassy?
Sassy?
Yep. Sassy's ready to come out.
The elk are huddled in a distant corner of the pasture, far away from people. So Mike heads out to herd them closer.
So as soon as they get them in here, I'm gonna be ready with Sassy and give them a dirtin'. So we're just trying to get up close enough to them to get a shot without getting them too excitable.
Cows start acting spooky and they get the whole herd riled up.
So here we go. Stop, 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 stop. They're pretty excited, so it's hard to get them to stand still, and they're just kind of running right past us. I can't aim in this direction because it's back where the public is. And so it really only gives me one direction, and they're really whipping around in here already.
Problem is, all this activity is scaring the elk.
As these animals get more stressed, they're releasing more adrenaline. The adrenaline competes with the drugs, so that means I have to use more and more drug. So it really starts to become dangerous for them.
So Michelle's got to move fast, or she'll lose her chance.
You hit her perfect. It was moving too.
Thanks,
I mean,
yeah.
that's a shot you should be proud about.
Oh, she's staggering. Oh, she's down. Her head's still up, but she went down. She's taking her time and going down. Oh yeah, her head's going down slowly. I think part of it has to do with the fact that she's really riled up and she's been running around and the animals are a little bit on the stress side.
And that makes the effects of the drugs a lot harder to predict.
Hey, girl.
So Michelle must be extra careful.
Hey. Hey. Any of these large deer species can be dangerous. If they're not completely sedate, you really have to watch them. An elk could kill you in a second with one strike of a hoof. Oh, don't do that. Here, let's just back up. That was a close call. It got my adrenaline going.
Finally, the elk is out cold.
You guys have your sample kits and everything?
Yeah, Dave.
So I'm gonna go first from behind, but we'll just be super safe.
After Michelle's frightening experience, she has only a short time to run tests on an animal that was highly agitated before sedation.
Rectal sleeve, check. Going in nice and slow. They have a really good sized rectum, actually. I'm just checking to see if she's pregnant. No, she's not pregnant.
She's not?
No. It's a good choice of an animal because we were trying not to dart a pregnant one.
Michelle hurries to take a blood sample and inject a dewormer. By then, the elk's already struggling to get up.
Heads up, heads up. She's starting to move. She's starting to move. Everybody move back. I hate this part. I hate waiting. It's just, you know, it's nerve-wracking. It contributes to a lot of graze. Here we go.
There she goes. Oh, she's up. Oh, she's almost up. There you go. That's a good girl.
Perfect.
After the elk's reaction to the sedation, Michelle decides to change her plan.
There's just too much space in here for them to get away from me. Kind of just chase them around in circles, and that's not good for them. Their tongues are starting to hang out. They're stressed. So we're gonna call it on the elk.
Leaving the elk to settle down, Michelle gets back on the road.
So we're going to Moose Mama's.
She's promised to help her friend Dana with some baby moose who are in big trouble. Dana runs a rescue for orphan moose calves. And unfortunately, spring is her busiest time of year.
In this stretch of road alone, between Palmer and Anchorage, there's around 200 to 300 moose are killed every year hit by car. So in the springtime, when those moms are hit, there's a lot of orphan calves that result. Hey.
Hey,
How's
how
it
are
going?
you?
Nice to see
Good
you.
to see you again.
Yep.
Thanks for coming.
Moose Mamas rescues, rears, and releases moose calves back into the wild.
We want to protect the moose population in Alaska, and normally these calves don't stand a chance without their moms.
Sounds like you got your hands full already.
Yeah, we have 2 females right now.
Okay.
The last one we got last night, picked her up, broken leg.
Oh.
And I got it x-rayed.
Okay.
Very dehydrated.
Okay. So she sounds pretty serious.
Yeah.
Okay, well, let's check him out.
All right.
I don't really know what caused the problem in the first place, but from the fracture, the animal could be in severe pain and go into shock.
But Dana's thinking positive. She's named the orphan Hope.
Hope was found on Northern Lights here in Anchorage. We have a lot of moose here in town, and we don't know what happened.
I know. Tough start. Tough start. It's a good thing that she's showing a little bit of a fight.
When they're too lethargic and just sit there, that's when you start worrying.
So I'm just taking temperature, gonna check the hydration. 98.1, which is great.
That's what.
Oh, that leg's probably a little sore. Yeah. It's got a pretty mild fracture. I mean, a fracture's a fracture, but it's not displaced. And it was casted nicely. And it was eating great at first, although it was kind of dehydrated. So we're trying to figure out why is it still kind of down and really hasn't come around. How's her suckle been recently?
It's a struggle. She's interested.
Yeah.
She's just not latching on.
Okay. Since it came in yesterday, it really hasn't been nursing that well. If they're not nursing very well, their glucose goes quite low, and they can be dopey and not want to do much of anything. Okay, she's pretty pale. Like her, see how pale her tongue is and everything?
Yeah.
When you see pale mucous membranes, it can mean things like shock. It can mean that there's maybe some internal bleeding.
And we don't know what happened to her, how she got the injury in the first place.
Exactly. So I'm gonna check her glucose. We're probably gonna need to give her some fluids with some dextrose in it, and then if we can get a warm bottle and try her again with the bottle right now.
I think I've got the bottle ready.
Okay.
With a calf this young and unresponsive, every minute counts.
It can go south really fast. You can have her up and walking a few steps and thinking she's making progress to she lays down and you lose her.
Now the pressure's on Michelle to solve this mystery.
Because I don't know what's going on, I don't know how much time I have. So it's really important I figure this out quickly.
It can go south really fast. You can have her up and walking a few steps to she lays down and you lose her.
Orphan moose calf Hope is struggling. But with her vital signs all normal, Michelle is stymied as to why and working against the clock. She wonders if the missing piece of the puzzle is pain.
She has a broken leg. Pain from that can certainly make a calf not feel like getting up and nursing. Definitely want to make her comfortable so she feels like eating. So I'm just going to give an injection to her for pain. So it's a really good pain relief and anti-inflammatory. There we go. For the time being, I've done everything I can for her. She's on IV fluids, she's had her pain control. So I'm going to go check on another calf, and then I'm going to come back and see how Hope's doing.
The other patient is a youngster named Esther, who has what could be a serious problem in a calf this young and fragile.
Eats great. Mm-hmm. He's great. Walks around.
But just hasn't pooped.
Nope.
And are you 100% sure she hasn't pooped? You've gone through and made sure there's nothing in there.
Got on my hands and knees. Okay. I'm a concerned mama, okay?
I can believe it. It's actually a serious situation. Young calves got fluids going in. They need to be urinating and defecating normally. Otherwise, she starts to absorb all those toxic waste products that she's not getting rid of. It could cause a rupture and even cause a downward spiral. I'm just getting stuff ready to be ready to give her just a warm water and a bit of lubrication enema, really gently, just to try and help things move along. Okay.
Ready?
Yep, I'm ready.
Let you go first one.
What I'm gonna do is have them put a blindfold on her right away, give her the bottle so she stands still, and then I'm gonna go ahead and check the back door and see if I can get things flowing. Oh yeah, there's lots of poop there. Sorted, okay. There's definitely some dry feces right there. And I'm just trying to stimulate her to go until she wants to go. So I'm actually putting that, trying to get up a little bit ahead of the feces. And just real gently put that in there. Success. The sweet smell of success. No moose poop. All right, no problem.
I think that's
Okay,
it.
we're done. Esther looks actually quite relieved. She even looks a little more perky. She's kind of moving around real excited. And boy, does she take her bottle quickly.
Don't be mad at me. I didn't do it.
I think it's the best outcome we could hope for, literally. And I'm sure she's gonna be feeling better. Mission accomplished. Poop bump. Moose Mama's poop bump.
Love it.
But when they look over to Hope's pen,
Oh, look at that.
Michelle is amazed at what she sees.
That looks way better than I expected. As I'm walking away from Esther, I notice that Hope is on her feet. So that's very exciting. She's got her whole face in there trying to drink. She's like perky, she's putting her face in the bucket, sort of looking for something to eat. Couldn't have asked for anything better at this point. What we really want is for her to take a full bottle. We're just trying to get her to nurse, so what we're hoping for is a big sound.
But she's pushing it away. Read that bowl.
Whatever it takes to get you drinking, eh? Sometimes they can figure it out.
The bucket looks like it's doing the trick, but this is just a small step on a long road to recovery.
We're not out of the woods. We have to watch her 24 hours a day, constantly. I'll be setting my alarm for every hour and a half, making sure that she's comfortable. Yeah, we're not out of the woods.
With her drinking and eating normally on her own, she should start to heal the fracture. I've got some hope for Hope.
With Hope and Esther on the mend, Michelle and her daughter Willow head to Palmer, Alaska, where Denise Hardy's reindeer farm is a regular stop on her spring rounds. Today, Denise is worried about a yearling reindeer with a serious injury.
She's got this swollen spot on her leg. Initially, we thought that it was probably broken. She's been losing weight, fighting infection, and I just don't know what to do for her.
Denise doesn't know how the reindeer broke its leg, but thinks it might have been kicked by a herd mate. As they go off to look at her, Willow finds a friend who takes her on a tour of the farm. Luckily, there are plenty of animals to meet, but Willow's favorites are the new spring arrivals.
This is kind of a paradise for kids.
You're fluffy.
Willow's having a field day running around with her little buddy.
It's good to be fluffy.
Knowing this case might be tricky, Michelle has brought along vet tech Tracy. A quick look at the reindeer confirms there's reason to be concerned.
Ooh, look at that lump. Wow. Denise has kept this young yearling reindeer separate for quite a few weeks now. At first we thought maybe there was a fracture, but now she's noticed some drainage, some pus is running down her leg.
The pus is coming from a lump caused by an abscess. Michelle fears a life-threatening infection could be spreading fast.
Okay, well, we'll go get the dirt ready and everything, and we'll reconvene here in about 5 minutes. All right. A watched reindeer never goes down. My grandma told me that one. No, I'm just kidding.
Was your grandma a veterinarian?
No, an animal lover, big time. I get it genetically. That and my cursing problem got from Grandma Gooch. Once we get her stable, I think we're gonna try and move her out of the wind and into a spot where we're gonna recover her anyway.
And Denise has come up with a way to move the reindeer that would make Rudolph chuckle.
This is kind of different, pulling Santa's reindeer in a sleigh. Isn't she supposed to be pulling Santa's sleigh? Oh, the smell of that is unbelievable.
It's been faster in a while.
There is a huge lump here. There's a really big lump on her femur, which is the bone going here. And it feels bony and hard, so I wonder about a fracture. She's kind of fighting two things. She's trying to heal a fracture of a very large bone in her leg, and she's also trying to fight off an infection, and her body just can't keep up.
You didn't feel something was there?
This is pretty extensive. I think this is more likely a foreign body that got in there and started a big infection. And it could have happened the same time that the leg was fractured, because it certainly feels like there's a big swelling there. We'll go ahead and drain this and get this going.
Denise couldn't examine the reindeer earlier for fear of re-injuring its broken leg, so the abscess has been festering for weeks.
I've been so worried about her.
So I'm just giving her an anti-inflammatory that helps for pain and inflammation. It's basically a pocket, and so it's just like sitting there like a big pimple, oof, like that. When you have a great big abscess like that, sure, it's gonna open up and drain a bit on its own, but probably not enough. Oh, no. Holy. Good Lord. The risk is that she'll get septic and die from that massive infection.
Michelle can only hope she's gotten to the young reindeer before it's too late.
Oh, boy. Oof. Yeah. It smells like rotten everything.
At a time of year when Alaska's bursting with new life, Michelle's bursting something much less pleasant.
Oof, like that. Oh, no.
Holy.
Good Lord.
An abscess on a yearling reindeer.
Oh, boy. Oof.
Yeah.
It smells like rotten everything. The smell that's wafting up is kind of like when roadkill meets rotten eggs. Like, it's just knocks you back. Oh, the pressure must be incredible. Like the relief of the pressure. Oh, you poor lovey. When you have a great big abscess like that, the risk is that that infection is not being completely walled off, and it's starting to go into her bloodstream. Pretty soon, you know, she'll get septic and die from that massive infection.
As Michelle's pushing, every time I think she's done, she pushes again and more comes out. This is just unbelievable.
Once Michelle has removed as much pus as possible and flushed out the wound, the next step is making sure it continues draining.
The tube I'm putting in now is a Penrose drain. Now you see I pull that through, and that's gonna stay hanging out for a few days, and it's gonna help everything stay open and continue to drain out.
To heal this nasty infection and get the young reindeer back on her feet, it's gonna take time and antibiotics.
Right now, she's awake from the anesthesia. She's got her head up. She hasn't tried to stand yet, and that's fine. I'd like her to take as much time as she needs. I hope you feel better.
But just when Michelle breathes a sigh of relief that the reindeer's on the road to recovery, she gets a desperate plea for help from Dana at Moose Mama's.
There's a male calf. Some people have noticed the calf laying in their yard. No sign of mom.
Dana just called. She's en route back to Moose Mama's with a moose calf that's critical, so I'm gonna meet her there.
Can't hold his head up. Very lethargic. We just gotta hurry home. No, come on, little guy. Hang in there.
This dangerously weak orphan moose calf is one more spring baby off to a shaky start.
When a calf is 3 days old, not getting up, this is emergency. Every hour, every minute counts. Not good.
Michelle is at Moose Mama's waiting for Dana and the calf.
Almost to the gate, little guy.
The weather is sunny, but cold and windy. So getting him warmed up is priority number one.
The temperature at Moose Mama's has dropped about 20 degrees in about the last half hour. We're gonna have to move this calf indoors and keep it protected from the wind.
For the calf Dana has named Paul, a converted horse trailer will serve as a field hospital.
We have a big trailer with some crates and straw set up already, and we're really worried about temperature right now.
They don't know how long Paul was left alone, but judging by how cold and dehydrated he is, it could have been days. So Michelle inserts an IV to deliver heated fluids.
It's often a mystery when the calves come in. What happened to them? What's their backstory? This calf is really depressed, meaning mentally it's out of it. It could be the mom was hit by a car. It could be she had twins and she abandoned the calf. There can be a whole range of things. These guys get separated from their moms. They're not nursing. So they're not taking in any kind of nutrition. So they're low sugar, low body temperature, and they're super dehydrated.
Michelle adds dextrose to try to raise this little guy's blood sugar and perk him up.
Even if you get them rehydrated for a little while, their kidneys had such a shock that they have kidney problems later. How are you, huh? You're blinking your eye. Yeah, oh, hi.
Hi. You like some sugar, huh?
That's what Willow does when I've got something sugary around. She stands up for it.
That's what I like to see as soon as you hook this up. Lifting that head always gives you hope.
Can you make a bottle, too?
I've already got one going.
Okay, good. Dana's getting everything set up so that we can warm up the fluids. She's running warm water back and forth. It's a busy time, but it's important to get all this done as quick as possible. The calf came in totally flat, not moved at all. We started the fluids, started giving it a little bit of sugar. It's lifting his head up, and that only took a few minutes, which is good. I mean, it really just needs a little boost of sugar often to get him a little bit perkier.
Unfortunately, the sugar high doesn't last.
How's your suckle?
Well, you're trying. It's very weak. But you know what you're supposed to do when something's in your mouth, huh? Oh, that's so sad, huh? You're trying.
But Michelle and Dana aren't giving up yet.
Let's try the bottle.
If Paul can down some milk, he'll get the calories he so badly needs.
Come on. He's just too tired, I think.
This one.
He's trying to latch on. He's just too weak.
So Michelle moves on to plan C, tubing milk directly into Paul's stomach.
And now you're gonna get milk whether you like it or not. And I'm trying to get him to nurse while I'm doing this, just because a little bit of a suckle. I need a bit. Pull it out. Okay, you got a little bit. So I just tubed him with some milk. And it's not ideal. It's better if they'll nurse and suck. Oh, you poor baby. But now you get some milk. It's gonna be really important just keeping him warm all night. He's had some milk now. He got about maybe 3 ounces or so. We wanna at least give it a chance. I have seen some of these guys struggle for a couple days, but eventually they're quite vigorous, and we've released some to the wild already.
I just wish we got him a little sooner.
I know, yeah. It's a tough job. I'm glad you're trying to do it.
It's gonna be up and down for the next 24 hours. You know, we'll probably stay up all night, watching, observing, see how he does, but at this point, who knows? Whatever it takes right now. Oh, sweetheart. You're trying, aren't you? You're a fighter. Come on. Come on.
At Moose Mamas, Michelle and Dana have been struggling for hours to save an orphan moose calf. Dana stayed with him throughout the night.
We knew the first night would be pretty critical. I stayed in the trailer, in the straw, keeping my eye out on Paul, making sure his IV was staying warm, making sure he was still comfortable. By morning, he had passed on his own.
We put a lot of our heart and soul into this. And I know Dana especially, overnight, multiple hours all the time, and it's just, you know, when one doesn't work out, it's hard, but she has other calves that are doing well because of all her efforts.
One of them is Esther, the small female who had a dangerous bout of constipation.
Oh, you look great. Look at you. You look so healthy. Oh my God, she looks awesome.
Yeah.
Oh, she looks wonderful, Dana. She's so big and healthy.
She's so healthy.
That's fantastic.
And you can already tell she wants back out there.
Yeah, great.
Yeah.
But before Esther can be released, she needs a clean bill of health.
Since she is really kind of wild, I'm gonna have her distract, and I'll watch those legs for you.
Thank you.
Okay.
Of course.
What do you think we have, huh? All right, see if she can.
To boost her immune system and get her ready for the wild, Michelle gives her vitamin E and selenium injections.
That was the first one.
Watch these legs.
That's the second one. Good, done. She's feisty.
Well, we want to keep her that way.
That's right. You're doing a great job of that. What a difference in just a couple days.
She's great. I have like more than 5% of her body weight every day.
It's good to get in there and handle her just a little bit to keep tabs of it, but as she gets bigger, the important thing is for her to not keep associating people with her. Even though it is Moose Mamas, it's a Moose Mama that's trying to wean her.
Because Paul was in such bad shape, he was an exception. But typically, Dana handles the calves as little as possible.
We don't go in and spend time petting, for sure. We're not doing them any favors by cuddling up and getting them used to humans. It's the last thing we do, so it's in and out.
That's it?
She's great.
She
She's
looks
awesome.
wonderful.
I couldn't ask for a better candidate for release.
Michelle's on her way back to the reindeer farm. And as soon as she arrives, Denise has a patient for her to see. She asks Michelle to examine a calf she's especially worried about.
Hey, Denise. How's it going? Nice to
Luckily, Dr. Amy Doyle and a few vet students are along to give her a hand.
So what can we help you with today?
Well, I have a little calf that was actually abandoned by his mother, and he is now 2 weeks old, but since I've brought him in and been bottle feeding him, he's got like a weepy eye.
Oh, okay. Let's check it out.
A weepy eye might mean the calf has conjunctivitis, possibly caused by an infection, a condition he could spread to the rest of the herd.
Oh, hi. Oh, man, are you cute?
His name is Hermes.
Okay. And so when did the weepy eye start?
He's had that since I brought him in.
Oh, okay.
So
Looks like he's got a little bit of entropion, where part of his eyelashes are actually rolling into his eye, and that can cause an abrasion and even an ulcer. You can see how red and unhappy the conjunctiva is. And you can also see how his eyelid is rolling up. So all the hairs and the eyelashes are actually scraping the surface of his cornea, and that's what's likely causing all the tearing. But what you can do is actually just do a little stitch to tack it down, and that stitch just stays in for a little while his body develops and grows some more, and that keeps the eyelashes from scraping on the surface of the eye.
Okay, good.
Doing a quick tack of the skin back for an entropion is a very quick procedure. Less than 2 minutes and you've got it fixed.
But using a needle right next to an eye is a little nerve-wracking for their tiny patient.
That's a good baby. One more little poke. Perfect. Whoop, whoop. She did kind of a little bite there and a little bite lower down. And now when she ties it, it should roll the eyelid out just a little bit. Enough that the eyelashes won't be scratching on the eyeball anymore. You're gonna fix up your eye. It'll feel so much better. Whoop, 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 whoop. I know, you're tired of being held now. I know. The worst part's over. Okay, okay. Okay, okay, let's let him go a little bit.
He's good there.
Okay, all right. Good, 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 good. Okay, okay.
Later, Denise will remove the stitch, and little Hermes should be as good as new.
If that's gonna make it feel better, though, now you won't feel like something's poking you in the eye all the time. Okay.
While they're here, Michelle wants to check on the young reindeer with the abscess to see if her infection's draining and healing.
Should we go check and see how she's recovered?
Yeah,
then?
let's
Okay.
do.
All right.
I hope that drain tube is still in too.
Yeah. Oh, I hear somebody talking. Oh, there she is. Oh, she looks pretty alert now.
Yeah, she does. It's a good sign she's eating.
Yeah. I haven't seen if the drain's still in. Oh, yeah, she's putting weight on it. Awesome. Yeah, that looks really good. Oh, she's.
Oh, yay.
That's awesome.
All right.
It looks fantastic right now, and so far she's leaving the drain in. We can't really put like an e-collar on her to keep her from pulling it, but oh, you look a lot better. Awesome. I'm really hopeful.
But with 30 animals still waiting to calve, Denise is making the most of Michelle's visit to her reindeer maternity ward.
Do you want to just walk through the herd and we'll just see if we notice anything else? As we go, everybody should be jumping up, honking, and walking different ways, trying to get away from us.
Okay.
And if we see anybody not doing that, then that might be worth a check.
Sure, sounds good. Well, there's 2 babies with 2 moms. Oh, is there something here or is that poop? It doesn't look like it's moving. No, I don't think so. Oh boy, I don't like that. Whoa. Oh, is there something here? It doesn't look like it's moving. No, I don't think so. Oh boy, I don't like that. Whoa, this looks bad.
At a reindeer farm in Palmer, Alaska, Michelle has come across a newborn calf barely clinging to life. One of spring's less fortunate arrivals.
In Alaska, spring is a tough time for the newborns. Not all of them make it. Oh, it is alive. I can already tell this is a calf that's gonna need a lot of attention. And the mom's a little nervous. Hey, Mama, it's okay. Body feels really warm.
Job 1, take the struggling calf's temperature.
It's good that you got a little bit of fight there. It's tiny, hey? Yeah. It's doing this open mouth breathing, and we're gonna listen to its lungs for sure, make sure it's not a pneumonia. The sun is really warm, and its body feels warm. Yeah, the mom is not excited about this. The mom's pretty nervous about us giving her calf a lot of attention. She's doing the typical caribou cow cough. She's being very attentive, which is good. That tells us she's been a good mom. Lungs sound okay. She's not all that dehydrated, but she is weak, for sure.
We like to do everything we can to save these calves. I can tell you that it's important to their mothers as well, because when a calf dies, a lot of times the mothers will grieve, and it breaks our heart to see that going on.
Okay, here we go. It's okay, Mama. How would you like some fluids, baby, and a little bit of a sugar boost? Okay. Let him go. Oh yeah, now you feel like running around, don't you?
His Red Bull surge.
Did you put caffeine in that too? So we've rehydrated the calf. We gave it some sugar as well, which is great. We helped it up, and it's weakly following its mom.
It just made us feel like we've done it, you know, we've helped her. We're really excited about that.
With the calf on the mend, Michelle and Willow head back to the Alaska Wildlife Conservation Center, where Michelle's about to take on an animal so ferocious, it's inspired a comic book and movie tough guy, the Wolverine.
We've been anxious to put the Wolverine in this big enclosure, but we were just waiting for you.
This particular critter proved himself an escape artist extraordinaire. On his way from his native Norway, he made headlines when he made a break for it at the Newark airport.
Oh, I was half out of the kennel, and they had to call the SWAT team in Hoboken, New Jersey. And
There was like 20 police officers. I got taken out onto the tarmac, first time in a cop car. And it was.
And you're blaming that on the Wolverine, is what I'm hearing.
Oh yeah,
Okay,
yeah, it's
okay.
totally his fault.
The Wolverine came from a Norwegian wildlife park that couldn't keep him. Now, Mike wants Michelle to neuter him.
If he were to escape, they're very concerned about putting different Wolverine genetics into a very healthy, strong Alaska Wolverine population. So that definitely wouldn't be a good idea.
Michelle's plan is to take away some of his fight.
This will be a first. We won't tell him that. But I've never castrated a Wolverine.
You know, the risks are kind of the obvious with Wolverine. Incredible jaw pressure, incredible amount of teeth, claws. Don't want anyone to get hurt. There's definitely a little bit of adrenaline, you know. Get your game face on.
Wolverines typically weigh about 30 pounds, but they can take down animals as large as caribou. So Michelle packs her dart gun with a hefty dose of sedative.
Good luck.
Okay, all right.
don't miss.
Thanks, Mike.
Since the Wolverine's escape attempt, he's been locked up in solitary confinement. Now, Michelle's worried he's scared and ready to strike.
You can see him there. So it's going to be trying to find leg muscle on him. And not missing, as Mike said. So you can hear him growling. He was growling like crazy, and it just really made the hair stand up on the back of my neck. The noise was intense. Especially coming out of something just this big, it was just a much bigger sound. So that injected into his leg, as you can see.
Now, she's just gotta make sure the sedative takes effect.
Wolverine are definitely a cantankerous species. Usually if you just even go anywhere near them in their enclosure, they're gonna come at you. So we're gonna be really careful about the anesthesia. I'm just gonna see if he moves. It's kind of a small enclosed space, and I'm gonna be really kind of stuck in there with him. If you go in there, you better be darn sure that he's out. Just gonna see if he moves.
Michelle's taking no chances as she gets up close and personal with a tenacious predator.
It's kind of a small enclosed space, and I'm gonna be really kind of stuck in there with him. If you go in there, you better be darn sure that he's out. He's not moving at all, and I'm making lots of noise around him. I'm definitely gonna poke him, give him lots of shakes before I ever reach anywhere near his head, because if suddenly he sees me, he could turn and bite, and that could be the end of my day. He's out. Okay, good. We're just gonna move the Wolverine right now. He needs to come out and get in a good position, give him some oxygen, we'll get started.
The procedure should be routine, provided he stays asleep.
So I'm about to neuter this guy. It's not that different from a dog neuter, a little bit trickier. Their anatomy's a little different, their testicle's a little bit tighter to the back. But have the smallest incision possible.
The Wolverine looks something like a bear cub, but looks can be deceiving.
It's actually a mustelid. So they have canine teeth and they look kind of canid, but it's more like a giant weasel. And they have very nice sized testicles for body size. I'm gonna go ahead and get this buddy out of the way. All right.
The surgery's a success. And there's more good news for this wily creature. He'll be released into a new pen with a little more space to spread out.
Back in you go. He's starting to come around from the sedation now, and it's finally time to move him into his new home. So we've got the crate in there all set, and as soon as he's a little bit more steady on his feet, we'll open the door and he can go out and explore in his new enclosure.
With the surgery complete, Willow rejoins Mom, just in time to check out an animal few get to see up close.
Look at his coat, hey? Fur is incredible. His nails are nice. Just bucket. One of the highlights of being able to do this job up here in the north is to be able to bring Willow It's fun to see her learn about the animals, and it's also awesome to see the empathy she develops for the animals.
Okay, so we're just gonna let him out now. Yep, I see you right there. That's open. Hang on, buddy, and let's back out. Just everybody out, and I'm gonna pull this wire there, Rachel. Okay, everybody back. Go for it, buddy, go for it. I love how they run. Kind of runs like a ferret, hey? Because they're weasels too. When you see their tracks, the tracks are like that. They're 2 by 2, 2 by 2, 2 by 2. And he's just checking out his new digs. I mean, he's like going all over, but he's really excited. He's sniffing everything and just super busy. Cool.
Michelle has one last stop to make on her visit to Alaska. Denise wants her to do a post-op checkup on one of her young patients.
Hey, Denise, how's it going?
Well, do you remember Hermes?
Do I? Hermes, look at you. You're so big. How's his eye doing?
He's doing really good. We removed the stitch that you put in, and he's got no more discharge.
Yeah, looks great.
And I believe it was this eye here.
Yep, that's right. Great. That looks awesome, and your eye looks wonderful. Beautiful. He's so friendly, hey, with all the people getting to see him.
Yeah. He thinks he rules the house.
I'll bet. Come on, Hermes, are you gonna follow us?
Before Michelle hits the road, Denise has a special surprise. A springtime sight that's rare even here.
I can see 2 feet.
A reindeer giving birth.
I have come upon an actual live birth in progress about 5 or 6 times. It's not often. They tend to go off alone and want to do it in private. So it's pretty special to be able to witness this today.
I mean, how often do you get to see a reindeer being born?
But as the reindeer cow struggles to deliver her calf, Michelle becomes concerned.
So she hasn't had her calf yet. She's been trying for at least a half hour, which is longer than typical. So we're trying to keep a good eye on her just to see if we don't need to pull it and give her a little hand with it.
Just as Michelle is about to step in to help, things take a turn for the better.
She's pushing more now.
Is it?
Yeah.
No, that's the head. Oh, it's hanging out. One good push and that's gonna be out.
This reindeer cow and calf, they're lucky. They've beaten the odds. I mean, life is fragile here. That's good to see.
It's super exciting to see this. Is that baby trying to nurse already? It's crawling over to her udder to nurse. He hasn't even tried to get up yet, but he swam in there and he's nursing. Denise, it's a girl. Yeah.
Howard!
Best selfie ever.
My favorite part of the whole birth process is seeing the mom take care of the calf and clean it up. And you can just feel the connection that they're building when they do that.
What a great day. I mean, it's just amazing to see it happen. You can see the placenta coming out now. So that's all happening normally. After the baby, she pushes out the rest of the placenta. That placenta is what was feeding that baby for the last 8 months-ish. I can't tell you what it feels like to be this close to, you know, birth. Brand new day, brand new life.